So thank you all for joining. Today, we're here to talk about housing is healthcare, and I have Justine Allenbach and Brandi Calvert here with me. So I'll just pass it off to you all.
Sure. Thanks everyone for joining this afternoon. As Livvie shared, my name is Brandi Calvert. My pronouns are she, her. I'm the Vice President of Housing Strategy for AFC and the Center for Housing and Health. And I have here with me my colleague, Justine.
Hey, good afternoon, everyone. Justine Allenbach, she, her pronouns. I'm a Senior Program Manager of Special Projects here at AFC in the Center, and I'm excited to be here.
A good place to start when we discuss our programs is to center ourselves around a participant story. And for this particular presentation, I'm going to share the story of a participant named Tara. That's not the client's real name, but we'll call her Tara for this afternoon. At the time Tara engaged with our programs, she was going into the flexible housing pool. It's our newest and largest program under the Center for Housing and Health. When she engaged with the program, she'd just given birth to triplets. Tara was already mother to a toddler, and her temporary home situation was living with extended family in a one-bedroom apartment. As some of you likely know, triplets have complex medical health needs, and her medical provider referred her into the flexible housing pool for housing assistance. Due to her engagement with the flexible housing pool, Tara was able to find an apartment that was suitable for her and her family. She received an apartment that was like 3 or 4 bedrooms at the time, and it also gave her easy access to get in and out of her unit with 4 young children. So that's why we're here. We're here to provide housing for families and individuals who are in dire need of assistance. So what is the flexible? What are AFC and the Center for Housing and Health? I like to call it a tale of 2 agencies. On the AFC side, as you all can see, there is an intense focus on people living with HIV. On that side of the house, we also focus on HIV services leadership. We work really closely with the Ryan White care system, and we also focus on behavioral health. The Center for Housing and Health is a supporting entity of the AIDS Foundation of Chicago, and it stretches our organization's purview. With the Center for Housing and Health, we focus on people who are homeless, but not necessarily those who are HIV positive. There's also an emphasis on research, and I'll share some of that later on in the presentation. The other 2 big things that we do with the Center for Housing and Health is focus on homeless systems coordination and also healthcare partnerships. And in terms of funding for both of our agencies, you all can see here that we have quite a bit of funding from HUD, the Department of Housing and Urban Development. We also have funding from HOPWA, which stands for Housing Opportunities for People with AIDS. And as I stated, the Flexible Housing Pool, which is our largest program at this point in time. In terms of the services that you can receive or anyone can receive from AFC Housing and the Center for Housing and Health, we like to think of our services along a continuum. At the beginning of this continuum, you have your services that we call the prevention solutions. That is our emergency financial assistance, and that is mostly provided to people who are living with HIV, and there's also funding for those who are vulnerable to HIV. In the realm of prevention, we also have our housing navigation program, and that provides housing location and tenant advocacy for people who are in need of housing support, and you must be low income and HIV positive for those services. Moving down our continuum, we do provide long-term rental subsidies without intense case management support. That batch of units and those programs are for people who are living with HIV only as well. For our homeless response system within AFC and the center, we do provide permanent supportive housing for people who are chronically homeless or those who are living with HIV. And permanent supportive housing is a best practice that ties a long-term subsidy with intense case management support to ensure that folks are successful in their housing option. Our programs function off of the Housing First model. And with Housing First, we believe that housing is the solution to homelessness. You can actually prevent homelessness by giving a person a housing option. I know that's a novel idea, but that's how we function our programs. And then secondly, housing first means housing with no preconditions. There is no sobriety requirement to be in our housing, and there's also no requirement to engage in medical or behavioral health treatment. Before folks can even attend to medical appointments, before they can attend to adherence to medications, they need to have a safe place to be able to live and to access other services they may need to have healthy lives. I spoke a bit already about the flexible housing pool, and we got some recent data through the research evaluation component of that program that really demonstrates the value of housing. With the first group of people that went into the flexible housing pool that began in 2019, there have been a lot of great outcomes for that population. They've seen a 33% reduction in their inpatient hospital stays. There's been a 19% reduction in their ED visits and a 22% reduction in people going and having encounters with jail who are housed in that program. And I think what speaks the most to housing being healthcare, of course, is that people in the flexible housing pool saw a 37% reduction in death to any cause. And all the reductions that we're sharing on this slide are seen when comparing people in the flexible housing pool to a similar control group. So great outcomes for housing. And I'll stop here to see if there are any questions or comments so far that may have come in with Livvie.
Yeah, thank you. It's saying the chat is disabled, so I apologize for that, but you're able to still submit questions through the Q&A part, and then we can read them out and answer them. Yes, someone asked if there's going to be a video that we can watch this presentation later and a link along with the slides. Yes, we are having this recorded, and we will put the slides on our website along with other resources.
Okay, thanks, Livvie. So we will move along. Okay, it's important to share with the folks in the room who may need help now exactly what AFC and the Center for Housing and Health can do to provide assistance in the short term. So in terms of how to access resources, I'm sharing with you all a couple of slides that have a couple of screenshots there that show how to access the HIV Resource Coordination Hub. Under the hub, you're able to get linkage to medical care, including PrEP support. And PrEP is pre-exposure prophylaxis for people who may be at risk of contracting HIV. You're also able to access resources for emergency financial assistance, and that is a resource that pays rental needs and also utilities for people who are living with HIV who may find themselves in their housing unit and behind. That resource can also assist with paying for first and last month's rent for folks who are going into housing of their own, or in some cases into a housing subsidy program. You can also get housing navigation, which I shared a bit about in our program continuum slide. And something else about the hub is that it's meant to be status neutral. That means that people living with HIV and those who are at risk can access services through the Resource Coordination Hub. And there's also a link there, Home HIV Hub, for folks to go and check out the website and see resources and services that are available. So I talked a bit about the different resources that are available through AFC Housing and some of the CHH programming, but there are other housing systems resources that are available, and I'm going to pass it to Justine at this point so she can share a bit about those resources.
Thanks, Brandi. Good afternoon again. My name is Justine Allenbach, she, her pronouns, and Brandi's noted some of the resources that we provide in-house directly at AFC in the center. Brandi also noted that we do some systems facilitation work here, and I want to highlight that work, and in particular highlight something called the Chicago Coordinated Entry System, which is a system we encourage anybody experiencing homelessness within our community to enroll in. So to provide a little context before I get into the coordinated entry system, I want to share with you all something called the Chicago Continuum of Care, which is an integral part of the larger homeless system we're going to be speaking to. And the Chicago Continuum of Care, often abbreviated as Chicago COC, is a coalition of 100+ membership organizations and individuals all collaborating together to end homelessness. The AFC and the center are a part of the Chicago Continuum of Care, but also a subcontracted partner to provide support to the coordinated entry system. Brandi, if you could move to the next slide. So the Chicago Coordinated Entry System and coordinated entry nationally was mandated by HUD, the U.S. Department of Housing and Urban Development, back in 2017. And the reason this was mandated for all continuums of care is because the systems in place for somebody experiencing homelessness in any community to enter affordable housing prior to CES was inequitable and typically favored people that were able-bodied and well-engaged in services such as staying in shelter or that had case management services. So with a coordinated entry system, rather than somebody experiencing homelessness having to go to multiple different sites and programs to apply for affordable housing, there is one universal housing assessment that should be equitable and accessible to all. And that one assessment alone will understand and connect you potentially to hundreds of housing programs in your community, depending on what you're eligible for. So again, the reason we have a coordinated entry system and that we've implemented this in Chicago since 2018 is so that we have an equitable system for anybody experiencing homelessness to enter our affordable housing programs in the continuum of care. I also want to highlight that the coordinated entry system is intended to pair people up with programs based on their needs. And because we have this universal assessment, we can truly understand what those needs are and which fit would be the best for particular households. Next slide. So what can somebody expect within the coordinated entry system? Before I go into this, I do want to highlight something that's extremely important, which is that housing is not guaranteed, even if somebody does enter and enroll in CES. Unfortunately, because of the scarcity of housing resources we do have within our continuum of care, we're only able to provide housing to the absolutely most vulnerable within our homelessness population. That's also something that CES serves to do, is to identify the most vulnerable populations. Moving back to the process of moving through coordinated entry, the very first step is somebody would have to complete that universal housing assessment. And participants complete that assessment with somebody called a skilled assessor. Currently in Chicago, we have approximately 90 skilled assessors available to complete these housing assessments. Last year alone, in 2022, they completed nearly 11,000 housing assessments. And the skilled assessors are actually something that the Center for Housing and Health facilitates and trains. So we're very proud of that work. Once somebody has had a housing assessment completed, they will enter the waiting period, which unfortunately is unknown. The reason it's unknown is because it's all based on the availability of programs within the continuum of care. So we can't quite understand or measure when programs will become available and what those waiting times would look like for somebody. But I can say, just based on my experience of working within the system for years now, that it typically takes at least 6 months for somebody to receive a housing match, which is the next step in this process. Again, it's not guaranteed that somebody would receive a housing match, but if you're falling within our community's current prioritization for our housing resources within coordinated entry, you will receive a housing match moving into that next step. Once you've been matched to housing, we understand in our community that it's not as simple as you have an apartment now, you're going to move into housing the next day. If you've been experiencing homelessness, and especially if you've been experiencing chronic homelessness, which many of our housing programs require someone to be, you will face a plethora of barriers to moving into an apartment. You may not have a state ID, a social security card, documentation of your disability. And so we like to pair people up with something called housing system navigation, which is somebody that will support somebody in the process from receiving their housing match to actually moving into their housing program, into that apartment. Of course, that final step of being housed is the most optimal outcome. But as I've noted multiple times, we have a scarcity of housing resources here in Chicago. So something AFC in the center is always doing is collaborating with our COC to advocate for more housing, so we don't have to only prioritize the most vulnerable. Next slide, please. I want to finalize our discussion about coordinated entry with how somebody can get connected to a housing assessment, that first step that enters them into the system. Perhaps the easiest way, if somebody does have accessibility to a phone, is for them to call the coordinated entry call center. The call center does have translation services available and is open Monday through Friday from 8 a.m. to 4 p.m. at the number listed here. The translation services are available, as I noted, but from my experience, I do recommend that someone call with a case manager if they have one that can communicate in English, at least in the very beginning, and then can communicate with the call center what type of language and translation service they would need in order to complete the assessment. And then you would be connected to the proper translator from there. Next slide, please. We also understand within the system and within our houseless community that not everybody has access to a phone or has the ability to verbally communicate. And so we do have in-person assessment access points, as we call them. These are listed here, and the hours and days that these locations are open is also available and noted in this slide. But these are in-person locations. Anybody experiencing homelessness could go to these locations during these times and hours and have the coordinated entry housing assessment completed with a skilled assessor in person. So that is also an option. Next slide. Okay. And Brandi, I'll pass it back to you to speak to the numbers and the need as I've been mentioning.
Thanks so much, Justine. Justine queued us up very well to talk about the need by the numbers and why we're here. As she stated several times during her presentation, there is not enough housing, supportive housing and housing subsidies out there to support the need. So if we look at the left side of the slide, we see a little orange state of Illinois. And these numbers are specific to folks who are living with HIV in our state. Recent data has shown that there are about 10,247 people living with HIV in the state who are estimated to need shelter or housing. And of that, just under 50%, so the 4,800 or so of these people have an unmet need. So that means these people, 5,000 or so folks actually need a unit, actually need some type of rental assistance to be stably housed. And looking at our nice skyline here in Chicago, there are about 65,000 people in the city of Chicago who are experiencing homelessness. And that's totaling people with any health conditions, just our general homeless system. And of those, there are about 17,000 kids who are in CPS who need schools, who need housing within the CPS system. This just shows the tremendous need for more housing support and subsidies in our area. And we can cite many different statistics and to show the need. Thinking about the resources available within AFC, we do maintain a wait list of people who are in need of a subsidy to be stably housed. And at last check, the number of people on that wait list was about 1,200. So just a tremendous amount of need and not enough units. And another reason that we're here is also to lift up our strategic priorities. And one of those, of course, is racial equity. Within our programs at AFC and the center, we do attempt to give power back to participants in our program. We have, with the FHP program, we have a lived experience advisory group of FHP participants. And then within our other housing program groups, we have community consumer advisory boards. And those groups come together to give input on program, on what's best for folks in the actual programs. And then in some cases, thinking of FHP, our participants actually work with the program in a governing capacity, which is super cool for them in the program. We also look to maximize our program outcomes. We want folks to be healthy and we want them to be stable in housing. And maximizing and having great program outcomes inherently helps people of color. As we look at the people who are actually homeless and those who are coming into our programs, about 85% or so are people of color. And at any given time, 75% are people who identify as Black by race. And we're also trying to disrupt some old school policies that are still impacting the Chicagoland area. You'll see in the map I have here, there's a map of like the Metro Chicago area, but there are portions of this map that are red. And this map is meant to represent where redlining occurred back in the 1930s when folks drew maps and decided where they would allow folks to live and buy housing. And as you can see, the redlining map of Chicago definitely still shows a tremendous amount of, there's a lot of segregation still happening in Chicago due to the history of redlining. Where we can see the red areas are where we largely have to place our housing participants due to higher rents in other areas. And this is also the same areas that Black folks were forced to live in from the 1930s due to redlining. So we have not seen a lot of change in the makeup of the city and where folks live since way back in the earlier 1900s. How to get involved. This is a great time for us to be having this presentation because we are coming up on AFC's annual Advocacy Day. And I have the registration information here for you, Advocacy Day 2023. It's being held at the Illinois State Capitol in Springfield on April 19th. And I'm also sharing with you the HIV Advocacy Day webinars for this year. So please think about getting involved in attending the webinar so you can learn how you can be most impactful with AFC and our partners through our Advocacy Day. And here I am also sharing contact information for Justine and myself in the event folks have any questions about the information that we shared. And that kind of brings us to the end of our presentation this afternoon.
Awesome, thank you both so much. Yeah, so now we have plenty of time for questions or conversation. The chat should be fixed, so you should be able to message in the chat if you would like, or still submit questions through the Q&A. We do have one question that came up, which is what sets FHP apart from other subsidy programs?
Sure. The flexible housing pool is set apart from other subsidy programs because it is a public-private partnership. The flexible housing pool is funded by the city of Chicago, Cook County, and also by different partner healthcare entities. And they're putting together a flexible pool of funding that will be sustainable to keep putting people into housing. I think what makes it also new and shiny and different from our other programs is that we do not see that requirement for people to have any specific health condition, or we do not see a requirement for people to be chronically homeless, as Justine shared. So it is a truly flexible source of housing for people in need in our area.
Any other questions or conversations, feel free to add them in. If we don't see anything more, then we can wrap up.
Yeah, and I'd like to highlight a comment from Jill Dispenza. Hi, Jill. Jill put into the chat in the QA, I believe, that EFA, the Emergency Financial Assistance Program, is also available to people who are using PrEP. So that means that you can have the same utility and rental assistance, and also, I believe, coverage for any healthcare costs that are related to PrEP usage. So thanks for the nudge, Jill.
Yeah, and I do see a question in here about Advocacy Day in Springfield. Do we meet at the AFC office and lead together? The answer is yes. If you would like to, we do offer free transportation to and from Springfield since it is quite far away. And we also provide lunch to the participants. So that is an exciting day. Trying to make it as easy as possible for everyone to be involved. And I see another question that just came through. Are we able to refer a person for the program even if we are not a licensed social service worker or case manager?
So the best way to get a person referred into services at AFC if they're living with HIV is to have them call the HIV Resource Coordination Hub, and people can refer themselves. And you do not have to be a social worker of any sort to refer someone into a program. You can act as their typical case manager or just a personal advocate. And then also Justine shared information for a person who may need housing that don't, that's not specific to any specific illness through the coordinated entry system. And would it be helpful for us to pop some of those slides back up pretty quickly for you all? Yep, okay, let's go back. Wait, did I go too far, Justine? So this is the information for coordinated entry.
I would share the previous slide to the call center number is probably the easiest way to get folks connected, but we understand that's not accessible for everybody. The access points are there too.
Okay. And I'll also go back in a second to the Resource Coordination Hub flyers. There you go.
All right. We have some other questions coming in about Advocacy Day. One question is, how can I prepare for Advocacy Day? That's a great question. We have 3 webinars coming up that are focused on different topics to help prepare you. The first one is in 2 weeks, and it's just about Advocacy 101 is the topic. And then the next one is empowering advocacy through storytelling, recognizing that storytelling is one of the most impactful ways to advocate and push policies forward. So that one kind of teaches you how to craft your story and why, certain things are important to you. And then we have more of a logistical webinar right before Advocacy Day for like what to expect. And then we'll have a post Advocacy Day community gathering to reflect and discuss. And then I have a question. Can people donate to FHP, Flexible Housing Pool, directly if they are not a healthcare entity?
We would have to talk back to the leadership of the Flexible Housing Pool about individual donations, but I do know that private foundations have donated into the program, surely. But we can connect you into finding out that information about any private donations. I see that it's an anonymous attendee that asked that question. But if you could reach out to either to the email provided here to me at Brandi Calvert, bcalvert@achicago.org, I can field that question for you and get a good answer.
All right, let's see. We have a question. What are some of the biggest policy priorities to advocate for AFC and CHH for Advocacy Day? Another great question, we have just released our policy priorities as an organization. We focus on quite a few, but there are some housing specific ones that I can speak about. Let me see if I can put it in the chat. But the housing one is HB 2481, a housing funding omnibus. We are advocating for $75.5 million in investments to the housing funding infrastructure in the state's fiscal year 2024 budget. And we can also share with you the Mobile Action Center, where you can, from that website, contact your elected officials on each of those policy priorities that are important to you, and advocate that way. So it doesn't have to just be on April 19th. It can be ongoing. And then let's see if we have any more final questions or comments. But I think we've answered all of them. Yeah. Well, thank you all so much for joining, and we'll make sure to get these resources out to everyone who's attended. Thank you all so much.
Thanks, everyone. Have a good afternoon.
Thank you.
Bye.